makes most women start a business? Is it passion, money, or freedom? Welcome to Female Founders, the podcast that takes you behind the scene with women who are founders and CEOs to help you start and scale a successful business of your own. I am your host, Gail Lebovic.
Hello everyone, welcome to another episode of Female Founders. Today I have the pleasure of speaking with Dr. Gail Lebovic, the innovative mind behind MammoPad and NasoClenz. As the CEO of NasoClenz, oncoplastic surgeon, patient advocate, and serial entrepreneur, Dr. Lebovic brings a wealth of experience and passion. Tune in to hear her amazing story and how her work makes healthcare better, greatly helping patients everywhere. Welcome, Dr. Lebovic, and I'm grateful to have you with me in this episode. Good morning, Dr. Lebovic, and thank you so much for giving me that chance to talk to you. You have done so many amazing things, especially for women, and I appreciate and admire your work and all the things that you do. I wish I could say all of this in French because it will sound a lot more romantic, actually, a lot more cool, but I don't think everyone will understand it. But in another word, you are an amazing woman doing amazing work to support other women, and I appreciate it.
Thank you so much. I love that. Very kind words. Thank you so much.
So now, what inspired you to start a career in medicine? Why medicine?
That's a great question. So, when I was young, my parents, they came to the United States from Czechoslovakia. They actually met in France. So I know un petit peu de français, but just a little bit. They came here with nothing really. It's the true American dream. And all they wanted was for us to have an education. That was really important to them. But for me, I was a gymnast when I was young. So I had a lot of injuries and I had a lot of interaction with, unfortunately, the medical system. And I had surgery at a young age on my knee for an injury. And I fell in love with what my orthopedic surgeon was doing. I just was so amazed that he could take a problem and fix it, and that was amazing to me. And then I had an older cousin who was in medical school. He was much more driven and, he knew he wanted to go down the pathway of medicine. And I was also inspired by that and started looking like in his books and everything. And I was like, wow, this is kind of interesting. But honestly, I had no idea what was entailed with that journey, which has been a lifetime. And it's been incredible. And I just love my work. I don't really consider it work because I love it and I'm so passionate about it.
But when you were a kid, you say you did done gymnastics. Is that something you were in love with as a child?
Yeah, I was. I did gymnastics for 12 years, had quite a few injuries. Yeah, had quite a few injuries. Was very focused on trying to get to the Olympics, but was not able to because of the, finally injuries. The number of injuries that I had 3 knee surgeries before I was 17 years old. So it was like, oh, game over.
Yeah, but you know what? I think that opened a whole new different door for you because you got to do something you enjoy doing. And that's including invent medical devices. What was the reason behind that decision?
Well, it's interesting because I do think, and you touched on this, I do think gymnastics gave me a very strong foundation. Because you have to have determination, you have to have passion, you have to love it, and you have to, when you fall down, you have to get back up and keep going. So those are very basic principles, I think, that really helped with a career in medicine, which was in and of itself challenging. But again, I just loved it. Another interesting fork in the road was when I was in medical school, and I loved surgery. I just loved it because patients come in with a problem and then you have a solution and you can fix it. And I think at the core, that's really what is my essence, is I'm a problem solver. And I exhibit that throughout my whole life. So I decided to go into surgery, but the dean of the medical school told me it's not for women. That's not a field for women. Yeah. It was a different day.
Wow.
It was a different day. And
just
he said,
like
if
that.
you like, oh, just like that. Yeah. No, you can't do that. It's not a, that's a man's field. You can't do it.
Wow.
And so he said, if you like doing surgery, you should go into OBGYN.
Why that?
Well, there's a little bit of surgery in there, but it's not quite the same. So I actually started in OBGYN, and I really did not like it. It was not my calling. I didn't like it. And fate would have it that someone dropped out of the surgery program, and they asked me to join the surgery program. So I did. Yeah.
Wait a minute. Hold on. At first, you are a woman, get out of here. And then now you can come in.
Yeah. Yeah.
Okay. I guess God was on your side.
It was fate. Oh, thank God, because, it's so easy looking back, but when you're in the moment, you don't know what the right choice is supposed to be, right? So I would encourage all women, really pursue what you love and your dream, because everything else will follow and will work out. It will. If you are passionate and you have a dream, you need to follow that dream.
Go for it. But from there, you decided to invent medical devices. What was the reason behind that decision?
Well, I think also the same core, of my soul in terms of being a problem solver. So I was in surgery and I witnessed how women were experiencing the breast cancer experience.
That's a big one.
And in those days, it was terrible. There were no choices. The surgeon made the choice, and it was really terrible to witness. So I said, gosh, if I'm going to make a difference, I better focus. I better get focused on this. And so I started to go down the path of becoming a breast specialist, a breast surgeon, which didn't exist back then. Didn't exist. And of course, all the men were like, why do you want to do that?
Why do you want to keep for breast?
Because it's a terrible field and we have to do better. And once again, people came into my life who were supposed to be there. One of them was Dr. Tom Fogarty, who really started the medical device industry. And he said, hey, I heard you're a breast surgeon. Do you have any ideas? And I was like, yeah, we need to do this better and this and this and this. And I started working with engineers on problem solving that directly addressed clinical problems that needed a solution. And we did one after the other, and then we did another and another. And I'm on number 9. Yeah.
And next thing you know, here you are. You remember earlier I told you are a technical person, just in a different way? Here it is.
Very different way. Yeah, because I don't know. In a lot of ways, I'm kind of the big idea person, but at the same time, I can also focus on the details. It's really important to have a team, a talented team, where you all come to the table with your expertise. Nobody can do everything.
It's impossible.
It's impossible. And it's not good that way anyway. You need a team. And I think being able to work with a team and get a team excited and everybody does their job as best as they can do is how you excel. And I've just learned that over a long period of time. So our team has been working together for more than 25 years.
Wow. The same people.
Yeah. And we get new people too, but the core, me and George Herman, who's an engineer who I've worked with for that whole time, it's just magical when it works. He's like, no, you can't do that. The laws of physics don't allow that.
I like him already.
But, you got to dream big. You got to dream big.
And that's the only way, isn't it? For example, as a gymnastic, if you didn't really get that interest into medical, probably you wouldn't be doing that right now. Probably you could have been one of these people that just like, I could have been that gymnastic. I could have been that better than that one. But just because of one fall and I didn't make it, you hold that up against you for the rest of your life. And I've seen people doing it over and over again. They hold something against them instead of learning from it and take that and do something even better to help society. And that's what you did.
Absolutely. Absolutely. There are no mistakes. There really are no mistakes in life. You have to learn from, maybe it didn't have the best outcome, but you got to learn from that and move on.
Yeah.
And that is something that is such a useful tool in life. I meet people all the time. They get stuck. They're stuck. Mm-hmm. And I don't understand it. I have a very hard time understanding it. It's like, just put it behind you and move on. Keep striving to be your best self every day. Like I tell people in our company, what we need to do is wake up every day, because every day is different. Every day you have another chance, and build value today. Do something that's going to build value and add to the company. And that's how little by little by little you actually come up with something that's fantastic and great and impacts hundreds of millions of people. It's amazing.
And I think that's how it's been done for generations to generations. And I think one thing that my grandpa passed on to me is, for as long as you are breathing, as long as you can move one tiny of your fingers, you got to keep moving forward. You can't stop. And by any chance, if you can't walk, well, start crawling like a baby. Isn't what you are doing as a child anyway? You are crawling on the floor trying to stand up and learning different things. Go back to it again. Start all over again. But don't ever give up, and always bring values to people. No matter what you are doing, make sure there's a value behind it. And I think if we all do that, like what you are doing right now, like when I look at some of your invention, it's just amazing. It's like, wait, a woman behind that? Really? This is it. It's like we're making great progress here as women,
Yeah. When you look back, when I look back, it looks like it was all planned. That's what's amazing. But none of it was. And for example, when I applied to medical school, 1 in 10 people got admitted to medical school. And wow. I was waitlisted the first year I applied. So I went and I got a master's degree in endocrinology in the meantime, not planned. I was waitlisted.
Well, you didn't want to just wait, I think.
Yeah, exactly. What am I going to do waiting? So I applied again. I was waitlisted the second time. Yep. And then I applied again and I managed to get in that time. I got into a lot of schools the third time, but still, the easy thing to do would have been, okay, it's not meant for me. It's not meant to be. I'll go do something else, but that wasn't what truly was meant to happen. So
you keep on trying.
Yeah. You got to follow your heart.
Give up. Yeah. And I like what you did, because even when you apply, you could have just applied, said, okay, I'll apply, I'll wait to see what happened. And then you just get some job over there, even if they're paying you $5 an hour. You just keep that and keep on. But that's not what you did. You actually went and get a master's degree. It's like, well, I'm not just going to sit there and wait. Let me do something else that can bring value to what I'm about to do in the future. I like that.
I think the important thing to realize is everybody we are all born with natural talent and gifts, right? You don't necessarily know what they are. You may not know for a lifetime, and then you'll look back and go, oh, wow, I didn't know that I had that gift or that talent. And so you have to keep going. It's like you said, or your grandfather said, as long as you are breathing, it's like a shark has to be moving constantly, and we are meant to do the same thing. You cannot give up. There's going to be challenges. Life is not easy. Nobody said it was easy. And people go, oh, how did you do that? No, it was not easy. I have a lot of stories, and a lot of challenges that were overcome. But, at the end of the day, that's what you have as a legacy.
Yes. I always say that life in pregnancy, they don't come with manual books. Life, it's like your parents give you life, and it's like you give birth to you. It's like, here's the manuals, daughter, go read it, and you figure everything out. It's the same when you give birth and you have that baby in your hands. Like, what am I supposed to do now? You don't have a manual either. You're on your own. And the whole purpose of that is because you're supposed to learn from it. And you're supposed to learn and then take that and turn it around and make it something beautiful, something that you can use later on to teach others. It's like, I think as we age, we get what they call wisdoms. And all these wisdoms come from the experiences that we went. Like, I gave birth to my son, but another mother that gave birth the same time as me, we didn't have the same experience. We all have our own different experiences, raise our children different ways, different cultures, different environments, everything completely changed. So that means that as each human being are unique and will go through life in different ways and learning different things that's supposed to pass on to the next generation, so they don't have to suffer like we did before. And I think that with yours, and like you said, you have the older you've been working with for such a long time, but you also bring in the new one that's about to learn from all that you guys has been doing for 25 years, that they might not have the experience that you guys already have.
Yeah, and what I love is watching them grow. Because, they come in and they're like, woo, and they don't know what's going on. But then we include them in everything. We let them listen to all the conversations. We, bring them and include them in the process so that they see the steps, the little baby steps that it takes to make a giant leap. And I think it's really important. What you said is critical as well. When we're growing up, we all think, oh, we rebel against our parents because they, discipline us and they say, don't do this and don't do that. And the reality is you get to a certain age and you realize they were right because they had that wisdom. They had that wisdom, which comes from experience. I like to say, you know what? It's not the years, it's the miles.
Oh, I love that. I love that. But it was entrepreneurship. Is that something you always wanted to do?
Is what? Excuse me?
Entrepreneurship. Do you always wanted to be an entrepreneur? Is that something you wanted to do?
Well, I never even heard the word. I never knew what it was. No.
What was that decision for? How did you make that decision?
It wasn't a decision. It just kind of happened. Again, seriously, it just happened. I started working with this group that was doing medical device development, the top in the world. They asked me if I could come and share some of my ideas with them in women's health, in particular in breast health. And I was like, sure. And we began to exchange ideas and information and develop a plan on solving some of these problems. Some of them were very simple. If you look at our products, they look very simple, but in reality, they're very strategically designed. They're incredibly engineered. So, you have to learn a lot in order to design devices and things like that.
Yes.
And it just evolved over a period of years. I mean, I found that I really loved doing that. I really loved designing products that could solve a problem. It was amazing.
But how do you feel when you see it in action? You know, let's say, for example, you go to an emergency room, or you go to when they're doing the breast. And I'm not able to do it yet because I keep asking for the doctor said go get old and come back. So you know, the breast test, it's an annual test that you have to do, and a mammogram. And I know you have one product for that. How do you feel when you see it in action? Like, it's not you testing it, but it's in action.
Question. I love that you asked that question, because one of my favorite products is the MammoPad. So if we have a minute, I want to talk about this.
Yes, please, please.
I was working on a different project, and I learned that, you know, when you have a mammogram, they basically squash the breast between two different plates, and then zip, they take an x-ray really quick. It's painful.
Okay. I haven't done it yet.
But they have to do that so they can make the tissue even all the way across, right? So they have to make it like this, kind of like a little waffle. and take the picture really fast, so there's very little radiation. Very little. And it's a life-saving procedure. So even though I'm a surgeon, you know, I know and I learned that pain is one of the top 3 reasons women will not get a mammogram. They go one time and then they never go again.
That's it.
And I said, wait a minute, why can't we do something to make the pain less? And that started this whole pathway about trying to develop a cushion for mammography. And when we did that, we learned really quickly, you can't put anything in the field where the x-ray is going to be, because then you can get artifact and you might have, you know, a reading that is incorrect. So we didn't let that stop us. We decided, well, let's create a foam that is invisible to the x-ray.
Invisible?
Invisible.
How is that even possible?
Well, we went to the foam factory and we learned how foam is made. And then we started testing different foams, and we had to make our own formulation. You know, once we figured out all the different aspects of how foam is actually made, and that's what we designed. And, you know, that product has been used by hundreds of millions of women. And if you put them side by side like this, it would go all the way around the equator of the Earth. So it's an amazing experience to develop something like that. And I'll never forget, one time I was sitting on a plane. I was going from San Francisco to Dallas. And the woman next to me asked me what I did. I said, well, I'm a breast surgeon. And she said, oh, I just had my mammogram. And they had a new product that made it softer.
Oh, no.
Yes. Yes. And it was like one of the best days, because that feeling is like no other. You know, doing surgery is fabulous. I love doing that, especially breast reconstruction, one-on-one. It's fabulous. But when you can impact hundreds of millions of women, it's a totally different ballgame.
Completely.
Yeah. It's a great feeling.
Well, but that's not it. You didn't just create that and stop. So there's a lot more than that you have done. And I know one of them, I'm not sure if I'm saying the name properly, is NasoClenz. Is that how you say it?
Oh, NasoClenz. Yep.
NasoClenz.
That's
Can you tell us a little bit about that one?
Sure, absolutely. So in surgery, many years ago, I learned that everybody's nose is actually really filthy dirty. And it makes sense, right? And again, I would say that most of my products that we've designed are common sense products. They're common sense. It's a common problem, and we come up with a common solution that has a sophisticated, you know, product.
But
So I've known about this problem for a long time, but never really had the chance to address it. And after we sold our last company, I was like, why can't we come up with something that's like a toothbrush, but for your nose?
A toothbrush, but for your nose.
Right? Because not that long ago, there was no toothbrush. And what happened? People lost their teeth. They had wooden teeth. They had dentures, because oral hygiene has transformed our lives. And many people don't realize brushing your teeth and just decreasing the amount of bacteria is good for your heart health. It's good for your body. It's good for your immune system. And I thought, well, wait a minute. We're completely ignoring our nose. And it's right in the center of our face. And it's connected to our lungs. So we cannot live without air. We can't live without oxygen. That oxygen comes in, it gets filtered through the nose. And you know as well as I do, the air is filthy. There's germs.
Yes.
There's pollen. There's toxins from, smoke. There's everything, allergens in the air. And so I said, well, let's develop something where we can clean the nose. But it was not easy. So we developed NasoClenz. It consists of, this is an applicator. It's like the toothbrush. Think of it like the toothbrush, but it's very soft. Okay. And this is a paper stick. This is kind of the current one that's out there. It's the first one. But we are coming out in the fall with one that's just like a toothbrush.
Oh, I like that one.
It's just like a toothbrush, this sustainable model. This one you can try. You can wash these, you wash it with soap and water. And then we have a gel.
You can use it again.
Oh, yeah. Oh. You have to use it again. And then we have a gel that is made just for the nose. So it's very gentle. It cleans and it moisturizes the inside of the nose. It kills germs. It gets rid of allergens. And it's a great new revolution, I think. That's just the beginning.
So too, but no kidding. With you, I don't think it will ever end. This is like you're just getting started.
Well, the thing to understand, about the nose is we can deliver drugs through the nose. We can deliver vaccines through the nose. So our device is designed first for cleaning and moisturizing the nose, and it helps with allergy symptoms. It helps with, obviously getting the germs out of your nose. But ultimately, we will use this as a drug delivery device. Yeah.
Well, hold on. Let me try to understand. So pretty much here, this one, you can use it at home or anywhere you are in the world. So you can just be outside. You feel like your nose feel a little bit filthy, and then you just put it on the gel on it, and you take it and you clean your nose, and then you put in a plastic bag you have on you. When you get home, you clean it, and that's it. You're done. But also, doctors will be able to use it.
Oh, yeah.
So let's say, for example, they need to put something in our nose. They'll be able to use that to do that as well.
Correct. That's right. And we have a physician, an ENT doctor out of Dallas. He's presenting in Miami in September. He's presenting using the device, just like you said, in his patients. Very exciting.
That's amazing. So you say, yeah, it is. So if they put the drug on it, it will automatically pass onto our nose, and it will work effectively, just like any other way they would have done it.
More effectively.
More effective.
Yeah, because the nose has a
and
very
less pain,
robust...
right? Less pain. So we don't...
Less pain. Yeah. You don't have to have an injection. And more of it will be absorbed because the nose has a very robust blood supply. So we can leverage that to our advantage, right? We can use a lower dose of medication, for example.
Oh, which is better for the patient.
It's all about the patient. Everything
you always think about them, right?
Yeah. Well, because that's what we need to be doing as doctors, right? That's what we should be doing, is helping people live healthier, happier lives. That's what it's all about.
But you know what, Doc? Not every doctor think like that. They don't. Some of them just think about themselves, not the patient.
Yeah, that's unfortunate. It
But
is. It is sad. It's sad to witness. I'm very much, I guess I'm a bit of a lone ranger, you know. I kind of stay very focused, and it's okay. I love it.
yeah, I think it's a great thing because when you, like you said, you were on the airplane and then that lady asked you what what you do for a living, and just like that, she was able to say something that's like, I could see your face, when she said that to you. It's like, oh, I created that. We created that. Me and my team did that. You use that and you love it. It's a whole different level, right? Compared to you, yourself, laying in the bed telling yourself, I did something great today. Well, it's just you telling yourself. It's not a bad thing. I'm not saying it's bad, but it's great when you hear it from other people. And I think what you are doing is putting people first, and they get to show you how wonderful you are, how amazing what you are doing is. And also, it's making a huge difference with your team, right? Because they know they're working for a company that's doing great work, that's helping
Mm,
others, and that's saving lives. And that's what's matter.
thank you for that. It really is what drives us. It is. It's just drives us to do what we do. And like I
But
said,
you have, hmm
it's not like
yeah, go
life doesn't
on.
present challenges. It does. But it helps you get through. I think having that perspective on helping other people helps you get through your own challenges.
Yes, yes.
It's like having a
And I'm
child. Like,
pretty sure, yeah,
go ahead. What were you going to
go
say?
on.
No, I'm
No,
done.
I was going to say that I'm pretty sure when you get off that airplane, when you went back home, you are way motivated when you were before to go out there and do something even bigger than that. And that's kind of like take you from being a number 10 to like an 80, like just like that.
Thank you. That's so sweet. Yeah, it does motivate you. It's inspiring and it's just great. Why quit? Why stop? Why? Doesn't make
No need
sense.
for it.
Yeah.
Yeah, no need for it. Don't get me wrong, some products you're going to make will do better than others and some will fail, but that's okay because all you're doing is trying to see what will work the best in the near future. Look at it this way: 100 years from now, your great great grandchildren will be using that product and laying in that room said, my great great grandma created that. It's just beautiful to hear it.
Yep.
Just imagine that.
It's really wild. It's a really great feeling.
But what other products do you have coming out or that's already been out?
Well, we have an entire line of the NasoClenz products, and next we'll be coming out with a mini for kids.
Mini,
Mini for kids. Yeah. Because kids, I
of
mean, they get
course.
sick all the time. They're just a walking petri dish. And so it's a really big opportunity for us to help people change their lives in such a simple way. We've already seen probably around 30,000 people have used it in the last year. And
Wow.
we have amazing responses from them, people with severe allergies that impact their work. People who travel a lot for work. I travel a lot for work. I use it every day because it's so simple. Or
Yeah.
if I go out in a crowd, for example, it gives me a way to clean my nose, which we didn't have. Again, it's so basic and such common sense
And
that
very easy to use.
it's very easy. It's really comfortable and it actually feels good. To be honest, it feels good. I live in a place that's very dry. And so your nose gets really dry and
Wow.
crusty. So you have to keep it moist and clean. Otherwise, you'll get sick.
But now, is there any drugs or anything like that anyone should be worried about that can actually maybe make you dizzy or make you feel a little bit like uncomfortable or anything like that?
Doesn't have any drugs in it. Doesn't have any medications in it. It's more, you can think about it just like a toothbrush, but for your nose.
That's all.
And then we will have a feminine healthcare product. That's going to be coming out. It'll be about 18 months from now, but we have a feminine hygiene product that no one has ever thought of or seen before. And it's designed specifically for, the vaginal area, to keep it clean, to help fight infection. Yeah, I'll be back.
You'll be back. Yeah, but this one sounds very interesting when you say that, because I know it's going to be hard for men to understand it, because it's not, it's more for women. But this is really amazing what you are saying, because I know, speaking for myself, when you're taking a shower, you got to go out there and try to clean everything to make sure, it's clean. And especially if you live in a hot place, you sweat. Don't get me wrong, you don't just sweat under your arm. You also sweat over there too, if you're someone that sweats a lot. And that can be an issue. So I think that I like that. So to keep it clean, and then
even every
infections.
Month, even every month, or when women are intimate, or, we know that women suffer a lot. It's about almost $5 billion to the healthcare system of women who have vaginal infections that become pelvic inflammatory infections that then impact their fertility. I mean, it's a whole nother major healthcare issue. Yeah.
So we're looking at for the products 2025 about that? No, but early 2026.
Early 26. We'll be back. We'll talk about it.
Yes, I can't wait I think that one will be a very great product as well, especially for women. And that's something we all know how it is. I don't need to spell it out. So if you listen to this, you already know how it is. So we need that product. But anything else you have coming out after that? I know that
that keeps me busy enough, believe me.
So for the nose one, you said that you have one for children that's coming out soon.
Yep.
So, and I know that
that'll be 25. But the next one that we're launching is this one, which is, like I said, it's just like a toothbrush.
Fancy. Yeah.
Yeah. It's not really. It's very very straightforward. You can really, put it in your suitcase, take it with you, and I think for travel, people really need to be cleaning their noses. It's so obvious to me. When you culture somebody's nose, it's not pretty. It's not at all pretty.
It's not.
And,
yeah, go on.
Well, I was going to say, from a healthcare perspective, 10 million people a year see the doctor for some kind of upper respiratory problem. And there's about 155 million people in the United States looking for nasal relief products. That's a huge number. So we have to bring them something to help. And I
think something easier. Because if you look at, you go to, for example, you go to CVS or Walgreens, and you will find some of the ones that I believe you put it on your nose like this. It's kind of like a water thing. And telling you the truth, that's super annoying. And I hated it, and I used it once, and after that, I'm like, forget about it. I'll just use a towel and be done with it instead.
Yeah, it really, it does help to irrigate your nose, but it's so uncomfortable. You have to have sterile or distilled water to do it, because if you do it from the sink, you get in real trouble, and you can't travel with it. So again, we look at the landscape and we say, okay, if we're going to design a product, it has to obviously meet the needs of the people. And that's what is so much fun about it. It's strategic. You got to think about every different angle that you can. And then you have to make something that really works and is effective and that people like. So we have, of those 30,000 people who've tried it, we have a complaint rate of 0.09%.
That's really high.
really low. It's really, really low.
I know. That's me. That's me being funny. I'm like, that is not a complaint rate at all.
And by the way, that includes shipping problems. So, yeah.
Yeah, for shipping that has nothing to do with you.
I know. But we track everything. We track all complaints, big, little, small, shipping, doesn't matter. We track everything. And so we know we have a winning product. We know people really like it and that it's really working. So now we're preparing for a bigger launch.
Bigger picture. But you know, one thing, two things I want to go into. One of them, you said earlier with allergy, and I suffer a lot with allergy.
Oh.
And where to 1 year, I couldn't stop coughing at all. I was like coughing all the time. Imagine it's COVID-19 and you can't stop coughing, and people is looking at you like, yeah, she has COVID. I don't have COVID. I have bad allergy. So it took me a while. Nothing worked. Yes.
I have something for you because NasoClenz, they did a study in farm workers. You know, farm workers are exposed to all sorts of dust and mold and particulates, and they have terrible allergies. So they did a study and they looked at these farm workers. They used NasoClenz twice a day, in the morning and in the evening, and they decreased their symptoms by 82%. Just the nasal symptoms, and their coughing and shortness of breath decreased by 70% because the nose and the lungs are partners. You know, they filter the air. So you need to send me your address so we can send you some NasoClenz.
Absolutely. And the second one I have for you, you talk about children, and I think one of I can relate to that product, and I'll be getting that for my son. Since my son was born, always have nose bleeding, and no doctor can figure it out what was the issue until I went to one woman and that said, "Oh, I can fix that." I'm like, "You can?" Okay. I'm like, "Well, you're gonna do the exact same thing they've been doing. They put something in his nose to block it so no blood come out." No, that's not gonna fix the problem. You need to clean it. I'm like, "Huh? Clean it?" Yeah, you need to moisturize it because it's dry here. And then he's super dry and the nose gets so dry and he likes to pick it because since he's been sitting in my office, he pick his nose at least 3 times. Of course, it's going to bleed. I'm like, the entire time that was my problem. So yeah, that was your problem. So again, she prescribed something just to keep on moisturizing it. And since then, the bleeding stopped. But with that said, I do have a kid that like to pick his nose. For no reason. I don't think he even realizes when he's doing it. He just does it. So all the time, for me, I have to keep his nose kind of like moisturized, clean it every day. And I think a product like that is awesome because it's easy to clean. And also you don't have to worry about using towels. And you don't have to worry about you should see me trying to put that thing in my son's nose when he goes up and trying to put it on. It's like miserable. So he will start screaming. He doesn't want it. And I think it's a great product, right? It's super simple. You just put the gel on it, put it on, and you're done. So I think that's perfect for families that's dealing with children like me.
For sure. We have kids who are using it, and they use it on their own, and they like it, you know? And it becomes then part of their routine, just like brushing their teeth in the morning before they go to school. They wash their hands, they brush their teeth, they clean their nose. It's really very simple. And that is true for your son. How old is your son?
10.
Oh, he can do it himself with the NasoClenz that we send you. He can already do it. No problem.
Yeah.
And
yeah, I think he should be able to.
Yeah. Nose picking is a chronic problem. A lot of people have it. We are looking to retire the finger because because you have a lot of bacteria on your finger, on your hand, and then you pick your nose and then it bleeds and that's how you get sick. So we are looking to replace the finger.
Retired the finger. You've been retired. So, you know, a question I wanted to ask you since the beginning. Most of your inventions focus on women. May I ask why?
Well, I had immediate need for that in my practice, you know, because I was a breast surgeon. not all, but most of my patients were women. And so I had a series of problems that, would present themselves and were more immediate. And then once I sold our last company, I thought I was done doing any of this kind of work.
I have doubt.
But that didn't happen. And then I started, thinking, well, wait a minute, I still want to fix this nasal issue. So that's why I went to work on this. And let's face it, everybody has a nose. So we have an opportunity to really make a huge impact, I think, on just people across all different spectrums, to help improve their health. And that is what keeps me getting up every day and working like a maniac.
So can you tell us about Silicon Valley Innovations? What invention fall under that company?
Everything. So what we did was we created that company. Silicon Valley Innovations is our parent company, and all the products that we're developing fall underneath that company. So we don't have to do another 10 companies. We can just put them all in there.
So what advice would you give to entrepreneurs in the healthcare sector?
Well, the first thing you got to know, it's not easy. Don't expect it to be easy. Surround yourself with a really solid team that works really well together. Play to each other's strengths and follow your dream and your passion, and definitely think big.
Think big. I think that's one thing a lot of people don't know how to do. Think big.
Think big.
How can people reach out to you and also the company?
I'm on LinkedIn, and our website, we have a website. So, good question.
I can cut it out, don't worry.
Okay, LinkedIn is good. Actually, we can post it at the end. We can ask Joy. I think there's info at svi-inc.com.
Okay, we can cut that out, no worries.
Yeah, let's do that. We'll put it up there.
And anything else you'd like to share with everyone else before I let you go?
I just want to thank you for having me as a guest on your show. I think what you're doing is amazing. Communication is key, especially for women. I think these days women communicate naturally. We love to hear from each other and learn from each other. So I think this format is a great format for women to learn a lot, and men obviously too. So I think what you're doing is extremely important and technical in a different way.
I think I need to become a student of yours. Go sit there and see how you're doing all those thinking and to come up with all these awesome inventions.
Oh, I think you've got a lot of ideas, and I think you have a lot of wisdom. So just, keep doing what you're doing, and same for all the women out there. Don't let, people convince you that you can't do it. Keep trying and go for it.
Well, thank you so much, Dr. Lebo. I don't know why I have issues saying your last name. I always try to say it in English, and I know I'm going to say,
Just call me Gail. That works fine.
Oh, thank you so much, Dr. Gail. And I appreciate what you do, and then how you think about women when you're doing it. It's not just, don't get me wrong, the entire population needs support. We all need help. But as women, we suffer a lot. And then a lot of time we hide it, we die with it, and no one knows why. And I think that because we don't want to complain, right? We don't want to be that woman that just keep on complaining. And then we just die with it just like that. And I think what you are doing is you're solving problems for other women that cannot speak for themselves. And I think that's amazing. And we need more women like that to come in. And don't get me wrong, I know it's not easy. And I know that other men probably look at you like, okay, you got all these things going on, because you're a woman and you are just rising up and rising up. And I know it's difficult, and but still, you never give up. And the people that believes on you, you use the support to keep on moving forward. And I'm grateful for what you are doing. And please do me a favor. Don't stop. Just keep on going, no matter what you hear. What you are doing is awesome. We need your help.
Thank you. Thank you so much. And we'll send you some NasoClenz.
Yes! Thank you for listening to Female Founders Podcast. That's it for this week's episode. Be sure to follow us on your favorite podcast app or connect with us on womel.com so that you don't miss our next episode. See you next time. Bye for now.